नमस्कार, शैल्बी हॉस्पिटल जबलपुर के फेसबुक पेज पर आप सभी का स्वागत है। जैसे कि 29 सितंबर को हम वर्ल्ड हार्ट डे मना रहे हैं और उसी के उपलक्ष्य में लास्ट 2 मंगलवार से हमने कुछ मिथ्स एंड फैक्ट्स पे डिस्कशन किया है। तो आज उसी सीरीज का 3rd एपिसोड है और हमारे बीच उपस्थित है शैल्बी हॉस्पिटल जबलपुर के वरिष्ठ कार्डियोलॉजिस्ट डॉक्टर आशीष तिवारी सर। सर, मैं आपसे रिक्वेस्ट करूंगी कि आप हमारे दर्शकों को अपना एक संक्षिप्त परिचय दें।
नमस्कार, मैं डॉक्टर आशीष तिवारी, मैं कंसल्टेंट इंटरवेंशनल कार्डियोलॉजिस्ट हूँ शैल्बी हॉस्पिटल जबलपुर में।
थैंक यू सर। इस सीरीज को आगे बढ़ाते हुए सर, मेरा आज पहला मिथ है आपसे कि अ लो फैट डाइट इज बेस्ट डाइट फॉर हार्ट हेल्थ।
So many of people do ask us whether the low fat diet is the best diet. So what I am saying is there is nothing like that low fat diet. You have to make your diet balanced. Fat balance is very important. It means you have to take fat in adequate quantity in your diet. In every diet, there is importance of fat in small amount. So you cannot eat only boiled food. So some amount of fat is adequate, but the fat should not exceed the limitation, like unsaturated fat, saturated fat. So unsaturated fat is better than the saturated fat. So we should avoid saturated fat, trans fat. Trans fat किसमें होता है? Trans fat is in chips, is in frozen fruits, in like that. Otherwise, saturated fat should be avoided, and this is a big myth that fat should be avoided altogether. It means you can have a teaspoonful of oil, ghee, other things in your diet. Just take in moderate quantities.
Thank you sir. So myth number 2 is all cholesterols are bad for you. So हम सुनते हैं good cholesterol, bad cholesterol. How it is affected?
So not all cholesterol is bad cholesterol. It means आपके कोलेस्ट्रॉल के कई सारे कंपोनेंट होते हैं. वो कंपोनेंट एसडीएल कोलेस्ट्रॉल, एलडीएल कोलेस्ट्रॉल, ट्राइग्लिसराइड कोलेस्ट्रॉल, वीएलडीएल कोलेस्ट्रॉल, उसमें से अच्छा कोलेस्ट्रॉल जो होता है वो होता है एचडीएल कोलेस्ट्रॉल, एचडीएल हाई कोलेस्ट्रॉल, एचडीएल कोलेस्ट्रॉल, and then other is LDL and VLDL triglyceride. So these are the different cholesterol. So one cholesterol should be increased. आपका एचडीएल कोलेस्ट्रॉल बढ़ना चाहिए और बाकी कोलेस्ट्रॉल कम होना चाहिए. तो जब आप किसी भी कोलेस्ट्रॉल की जांच कराते हैं तो कई बार आपको देखा जाता है कि आपका कोलेस्ट्रॉल जो है वो टोटल कोलेस्ट्रॉल की मात्रा दे दी जाती है, उसको अलग अलग पार्ट में डिवाइड करके नहीं दिया जाता है. तो वो टेस्ट इनकम्प्लीट टेस्ट होता है. हमको कंप्लीट टोटल कोलेस्ट्रॉल से कोई इंफॉर्मेशन मिलती. सो इट्स बेटर टू हैव ऑल टाइप ऑफ कोलेस्ट्रॉल in all proportions, then only we can decide which cholesterol is useful, which cholesterol is bad, but not all cholesterol are bad cholesterol. This is a myth.
Thank you, sir. Myth number 3 is if you have high BP, which is also known as silent killer, so how it is related to heart attack?
So hypertension is up to 30% in Indian population. So every third Indian is having blood pressure problem. So it does not mean once you have this blood pressure problem or hypertension, you will end into heart attack or heart kind of problem. This is not like that. So what is happening is those patients, those who are having hypertension, but they don't control their hypertension, they eventually end up into either hypertension or stroke or some peripheral artery disease. So the complication arises when the patient is having uncontrolled blood pressure. It does not matter whether you are taking blood pressure tablet or taking minimum tablet or taking 2 tablets or you are decreasing blood pressure by your diet. So it's important to have a low regular blood pressure monitoring with low blood pressure drugs, whether it can be 1 drug, 2 drug or 3 drug. So it's a very big myth that all blood pressure patient will be having and eventually having heart problem. This is not like that. Most of the blood pressure patient, I will tell you, is not having heart problem and will not have heart problem in the future also if they continue to maintain their blood pressure.
Thank you, sir. Myth number 4 is stress and emotional factors don't affect heart health. How true it is?
So I will tell mental health or emotional health, what we say, is very important for all kind of health, not only heart health. And stress cannot cause heart problem is totally wrong. Stress alone can cause heart attack. We have seen patients called as stress-induced cardiomyopathy or Takotsubo cardiomyopathy, where patient's heart pumping goes down up to 30 to 40%, which is normal is 55 to 70%. So 30 to 40%, and patient have only stress. Rest of things are totally normal. And as soon as the stress recovers, the patient heart function becomes normal. So heart attack can occur in stress-like condition. And second most common substrate in these conditions is there where the heart disease is underlying dormant, means you have a 70% or 80% blockage, which is okay, and you don't have any symptom. The moment you have a stress or something like precipitating factor, this heart rate, 70 to 80% heart rate blockage will behave like 90% because of high heart rate, because of palpitation, because of tachycardia. And then eventually you will end up in chest pain or heart attack kind of condition. So not only for the heart, for every part of the body, your mental health is very important. So one of the aspects which is totally ignored in India, the moment you seek a mental health, you are declared schizophrenic in India. So I think it's very important to have mental health, good mental health altogether.
Thank you, sir. So, like you said, chest pain. So, does heart attack comes with severe chest pain, and can we consider it as a primary symptom?
So majority of the patient, especially non-diabetic, they do have severe chest pain or some kind of chest pain or some kind of arm pain during heart attack. So in upper part of the body, below jaw, it's important is below jawline and upper part of the body can have any kind of pain, can have heart attack. But majority of the patient do have chest pain or something like that. Exception is diabetic patients. Exception is females. Exception is some dextrocardia position where the heart can be at abnormal situation. So in all these conditions, one can have only slight dyspnea or some shortness of breath which occurred few days back, and now she is okay. And then eventually it was found that she had heart attack. So these kind of patients do come to us very frequently, and right now also we have 2 such patients with us. So it's very important to assess these patients, and every chest pain, every sudden shortness of breath should be evaluated by a physician or cardiologist.
Thank you, sir. There's one more myth. Heart disease is a death sentence. There is nothing you can do once diagnosed. There is no hope for normal life.
So it's a very big saying. We had panel discussion a month back or something like that, where we discussed how many of the big billionaire companies, CEOs are having heart disease. Owners are having heart disease. The big conglomerate bosses are having heart disease, and they work for 8, 10, 12 hours a day, and they are physically fit. Many of these people, they achieve almost near normal fitness even after heart surgeries. So there's nothing like that. So here comes the importance of motivation and mental health. The moment you recover yourself, it's important to maintain the balance of the body, and this is very important to have this kind of approach that once I am doing better, I will always be hopeful that I will be doing better. So in long run, this is very important that the patient should be motivated to live a normal life. If you can't do that, then it's very difficult.
Thank you, sir. We have one more with us. Only overweight and obese individuals are at risk for heart disease. How true is that?
So it's irony that 70 to 80% of our heart attack patients are thin. 80% of our heart attack patients are thin. So this gives us some idea that weight is not the main determinant of heart problem. I agree to the fact that somebody having morbid obesity, somebody is having severe obesity, weight going 100 kgs, 120 kgs, with high cholesterol level, with diabetes level, with hypertension level. So obesity comes with all these burden, diabetic, hypertension. But somebody is having mild obesity with no diabetes, no hypertension, he does not have a much of heart problem. So the obesity paradox, where they used to say that obese people generally do not have heart failure or major heart problem, is coming true. So majority of our patients are thin. So it's a tobacco which is causing the problem, which is tobacco, smoking, cholesterol, diabetes, hypertension, which is killing more than the obesity. Yes, I agree to the fact that obesity is not a good thing, but obesity is now not the main determinant of heart problem. This is very true.
Thank you, sir. Now, another myth is medications can cure heart disease. So there is no need for lifestyle changes.
So medications are just a part of the treatment. So cardiac patient or heart disease patient need multifactorial treatment. First, they should eat right. Once, so it's very important that they should eat right. Whatever drug you do, if you keep taking high amount of calories intake and your cholesterol kept rising, no drug can save you. Second, they should reach a healthy lifestyle. They should walk, they should engage in the activity, they should play with the kids or grandkids, and all these activity will burn the calories and you will become full. The only thing is the cardiac in heart disease patient, the exercise is graded. Graded means the one day you will walk 100 meters, next week you will walk 500 meters, next week you can walk 1 to 2 kilometers, something like that. So graded is important. They cannot run directly run in a one day, but it's very important. Apart from medication, all type of treatment should be important, including lifestyle, including dietary modification, including giving up all your addiction habits. So if you focus on all these multifactorial things, then only you can achieve a better health. And all these heart disease patients who do all these things, they remain healthy for a longer period of time.
Thank you so much, sir. Like we spoke about medications, we often hear about medicines like aspirin, sorbet that cures heart attack. So can we take it as one of the preventive measures for heart attack?
So no. So this is a very big myth that some people are taking cholesterol medicines without indication. Some people are taking aspirin without indication, and some people take sorbitate for every complaint they have at home. So this is a very big myth. Suppose somebody is having low blood pressure at home and he is having some kind of uneasiness feeling, and you give sorbitate to them because the grandmother has MI, she used to keep sorbitate, and that this sorbitate does not cause any help in blood pressure, hypertension or blood pressure lowering. It further decreases the blood pressure. So here the sorbitate will deteriorate the patient, and the patient who can be stable will become sick. So sorbitate is a specific drug especially used for chest pain. So unless you have a severe chest pain or severe burning and you are already a heart patient, I don't think these drugs will act or prevent any heart attack or prevent any cause. Yes, you know that you are a cardiac patient, you have bypass hua hai, you are already went angioplasty, and you know that this kind of heaviness is because of heart, then the sorbitate might work, and no role for any preventive drugs like this. There shouldn't be any role. Only follow the advice your physician or cardiologist says.
Thank you, sir. Another myth is, are heart attacks always sudden and intense?
Yeah, most of the heart attack are sudden and intense, but as I told you, in diabetic, in females, in younger individuals, they might have some kind of uneasiness, gastric burning, and then it will go away, and next morning we'll get to know that the patient had heart attack in yesterday afternoon or something like that. So as I told you, MI or heart attack is having a wide range from here to here. So it can be just a small tinge of the chest discomfort to very high suspicion of heart disease. So very high suspicion of heart disease. So it ranges from 0 to 100, where 0 can be no symptom and 100 can be a fatal MI. So it depends on person to person. But yes, whenever there any acute condition is there, you should considering to rule out any kind of heart attack.
Thank you, sir. Another myth is, if you can talk and walk during a heart attack, it's not that severe.
So totally big myth. It's a big myth. The most of the people who eventually don't make it during their heart attack, most of these patients comes walking. So it's nothing like that. The heart attack is a progressive disease, and suppose that somebody has a heart attack in the morning, in the afternoon he might be okay, but the next morning he will become very sick. So as the time progresses, the disease increases, and the patient becomes sick. So this is true. It's a big myth. Then the patient can walk. Heart disease is not big. So every heart attack has potential to kill the patient. So every heart attack should be taken at most seriously. ऐसा कोई भी patient जिसका ECG abnormal है, echo abnormal है, blood test abnormal है, he should stay in the hospital or home, preferably in the hospital for at least for 48 to 72 hours. He should not go home. He should be under watch. So repeated monitoring, ECG, blood pressure should be done, and then only he can be better.
Thank you, sir. Today's last myth is we often hear about CPR. So CPR can restart a stopped heart?
Yes. So CPR is a cardiopulmonary resuscitation where you pump the chest wall beneath which heart is located. So suppose the patient get unconscious in a party, and before 2-3 seconds before he was all right. So in that condition where his heart was working fine 2-3 seconds before, 4 seconds before, the CPR might work. But same thing is not true when the patient is he woke up in the morning, he is not responding. In those conditions, CPR might not work. But in other conditions where you know that patient was fine few minutes back, you should do CPR and then you bring the patient to hospital. With this, I would like to tell that CPR will organize regular workshops for CPR. Any society or any school or any colleges who want a CPR workshop can request for us, and we can arrange them for the same workshop for free.
Thank you, sir, for your valuable knowledge and time. I hope a lot of myths are busted today. And next Tuesday, we'll meet on 26 September with episode 4 of Myths and Facts. Till then, stay healthy and be heart smart. Thank you.
Thank you very much.